Imagine I've got a very depressed patient in the consulting room and I've got to decide whether to dictate an urgent referral to the primary care mental health service for the patient to be seen within the next week or two, or whether I should really refer the patient to the A&E liaison nurse who's based in the A&E department for assessment later today. And I've got the map of meds in front of me. I've already put the smart card in and have accessed the map ready so that I can use it during consultations. And I would put in depression in the search engine. Here comes the primary care presentation, and I can click on the information button there and it tells me about the definition, tells me about epidemiology, pathophysiology or causes, and risk factors for me to consider, and the diagnostic criteria for determining whether this patient has depression or not. A quick look at differential diagnoses, including psychiatric causes such as postnatal depression, bereavement and generalized anxiety, non-psychiatric causes including medications that can often cause symptoms that mimic depression, or in fact other medical conditions that can also similarly present as though it may be depression. Look at the history and examination, including a link to the mental state examination if I wanted. Look at the diagnosis. I'm happy that this patient has got major depression. And are there any alarm signs? And it's asking me to check whether there's any evidence of risk of suicide, risk to others, risk of neglect, risk of using drugs or alcohol to regulate mood and anxiety symptoms, psychotic symptoms, or severe agitation. And in this particular case, the patient does have that. So if I click on yes, it's asking me to consider what the local policy is, and in all cases be sure to speak to someone over the telephone. At this point, I'd pick up the phone and speak to the A&E liaison nurse and ask for her advice and assistance.